Thank you very much, Matthew, and greetings from Sheffield, main office for Social Work England. My name is Colin Conway, and I'm the Chief Executive of Social Work England, and really pleased to be in this session today with my colleagues from the other regulators of social work across the UK, Wales, Scotland, and Northern Ireland. And how we're going to do this today really is I have a couple of slides just to kick off a bit of context around Social Work England and where we're at, and likewise my colleagues in the other jurisdictions will have a couple of slides. So we'll do that at the start, a few presentations, and then we're just going to open it up to a conversation around some of the kind of key areas that may be of interest to people. I noted, Matthew, that this is a session about regulation and with regulators. It's interesting you put a wee heart up as something to do. So maybe part of the achievement today is that we get somebody to put a heart up at some point. That would be really nice. One of the reasons why we do this, and this is a session that we do kind of each year as part of our social work week, is because social work as a profession in the UK is the only health and care profession that is regulated separately in each of the jurisdictions. So the regulation of social work has devolved across the four nations of the UK, which is quite unique to social work. And I think that that's linked really to the way in which policy in children and child protection and adult safeguarding is devolved as well. So it's the link to the profession and the policy, which again is quite unique for social work. So I think it's a real opportunity for us to be able to show how we work together, what's similar in terms of how the profession is regulated and regarded in each of the jurisdictions, and then where the difference is and what we're working on in different ways. So that'll be the kind of context for today. So firstly, our role and remit for Social Work England, and we are very much the youngest member of this group. The regulation of social work started 25 years ago, really with the development of each of the councils. And while we in England have had a couple of moves in different directions with regulation, the regulation of social work in the other jurisdictions has stayed pretty much the same. So the councils in the other jurisdictions will be a good deal older and more experienced than we are. But our role and remit comes from the Act that established Social Work England in 2017, and our overarching objective is protection of the public. Ultimately, that's what all regulation is about. In regulating the social work profession is about ensuring public protection, and to do this, we promote and maintain health and safety and well-being of the public. We promote and maintain public confidence in social work in England, which is really important, and we promote and maintain professional standards for social workers in England, and that's really where our professional standards come into play alongside standards in education and training. So that's the broad role and remit, and within that we can do a lot of different things. I thought it'd be useful just to show you the breakdown of social work across the regions in England. So we registered last year. Our registration ends each year. It ends at the 30th of November, and at the 30th of November 2025, there were just over 106,000 registered social workers in England, and this is roughly how they break down in terms of the areas that you may be from, or that you perhaps recognise. So there's and also in this slide, I thought it'd be useful to show the number of higher education institutes and social work programs that exist in each of the areas. We've completed now in our first 5 years an inspection cycle of all of the programs that deliver social care or social work, across England, and you must have gone on that social work program, registered with us in order to be a registered social worker with us. So there are a number of programs across England. So thought that would be interesting to see the breakdown and where you might put yourself in terms of the numbers of social workers. And as you can see, the split between kind of Yorkshire, the Humber, and the Northeast, kind of London and the Midlands, and in the Northwest is similar, and then two smaller areas, the southeast of England and Eastern England. But that's the sort of number of social workers that are working in England. And I always think it's useful to get a sense of that, because certainly, I mean, I'm a social worker by background, although I'm not currently registered. But I always, when I was registered social worker, I always had a great sense of the profession and a great sense of being connected to such a large profession covering so much ground and working in so many communities. I think it's always good to think about. One of the areas, in the many areas that we work in, one of the areas that always has a profile for any regulator is the fitness to practice. So that might be useful just to, again, give a little bit of data around fitness to practice. Although this slide refers to 24, 25, I've kind of got updated updated figures from 25 to 26. So in this, we received just over 1,900 concerns in 24, 25 to us, of which 4% went into investigation, and the number of those, again, less than 1%, would have progressed to a hearing. So the number of investigations, the number of concerns and complaints that are given to us about the profession is a relatively small number, and the number of those who make their way to hearings is relatively small. I think that's always useful to element of reassurance for people. But interestingly, this year, the number of referrals or cases that we've received, complaints that we've received as of today, so not quite the end of the year, but with 2 weeks before the end of the year, we've received almost 2,600 complaints compared to the 1,900 from last year. So that's a rise of approximately 35%. So there's been a significant increase in the number of concerns that we've received this year. We don't fully know why that is, and we're kind of working on that now and trying to work out why that is and what the nature of those concerns are and where that might have come from. But I think just to say that that's true, not just of social work, but also true of regulated professions across health and social care. So it's the same with nurses and doctors. They're also reporting that kind of level of increase, which I think is interesting and something for us to reflect on. Having said that, the number of complaints that have come into investigation is something similar. So last year, the number of complaints that came through from our triage to investigations was 19%. This year is 16%. So still, the vast majority of the cases that we get don't meet the threshold for investigation. So I just thought it'd be useful. What of course that reflects is a huge amount of activity in order to be able to respond in the right way to those number of complaints. People will know with Social Work England that over the last couple of years we have had challenges in timeliness in terms of being able to deal with the cases in a suitably appropriate time and to deal with our hearings in a suitably appropriate time. So we'll continue to work in that area and try and develop ourselves in that area. And people may also know that we're currently under an independent review. So as part of our founding legislation, it was set out that we would be reviewed 5 years after establishment. So we're now 6 years after establishment, so we're under that review. So that's kind of putting on hold kind of what our plans are, but some of the key areas that that we're thinking about in terms of planning are around strengthening our processes and approach so that we are able to be more timely, more compassionate and more effective through our fitness to practice process. So we'll be certainly working on that regardless of what the independent review says, although I have no doubt that the review will be encouraging us to do that. We want to increase our understanding, trust and confidence in our role with the social work profession to really build the uniqueness of the nature of regulation for social work in England. We want to look at, collaborate and connect our unique insights and analysis to inform and shape social work landscape, and that is looking at research and data and insight. The one thing that we have as an organization, no other organization has in England, is that we have a contact point with every single social worker in England. Every registered social worker has a contact point with Social Work England. So that puts us in a unique position to be able to share data and analysis around the nature and shape of social work in England, which is important for the departments, for employers, and for you as the registered workforce, the registered profession. And then finally, just to look at promoting change for a positive change for social workers throughout the professional journey. And that's really looking at the role of education and training, which we have a very clear role in terms of setting standards and inspecting against those standards and ensuring the quality of initial education and training in social work, but also looking at CPD and how professional development can be supported throughout a career. So they're the key areas for us. So I want to hand over to Tracy from the Northern Ireland Social Care Council, who will give a bit of background around her work. So Tracy, you're on mute. Just
At the pace today. My name is Tracy Reid, and I am the Chief Executive of the Northern Ireland Social Care Council. And I suppose when I'm thinking about this today, I think when I first heard I was being invited to speak here, I thought, well, oh goodness, I don't know what I'll be able to say, because I'm only in this job, I'm coming 6 months now. And I was, before that, a social worker. I've been a social worker for the last 25 years, and I was previously in my previous role as Executive Director of Social Work in the Belfast Trust, and my background has primarily been in adult safeguarding and adult social care. So when I came to the Social Care Council, I was very much, I suppose, thinking, well, I have so much to learn and so much to understand about regulation and about this area of work. And yet, now that I have arrived in this space, I am absolutely struck about the importance of that regulation, the influence of that regulation, and actually how regulation supports us, as social workers, to do our job. And it didn't always feel like that when I was a practitioner. I didn't always see that when I was a practitioner. Often used to think, well, what am I getting for my money that I'm giving them every year? And I didn't fully understand the breadth, scope, and influence of the organisation. So it's been an absolute delight for me to come into this space. So we come to Northern Ireland, just our next slide.
Sorry, Tracy, we're getting some really odd noise off your microphone. Could we take you off screen? We'll skip some slides and we'll go to Marie, and then we can maybe figure out your microphone in the background. Okay. Does that work? Just because
that's super. Thank you very much.
Yeah. All right, we'll do that, and then we'll fix it. Give me 2 seconds, Marie, and I'm just gonna jump to your slides. Don't look at these slides because it'll spoil it for people.
Thank you, Matthew. And I hope my microphone sounding okay.
Sounds good. Yeah, sounds good. Thank you.
Okay. Yeah, thanks so much, Matthew. I'm Marie Allison. I'm the Chief Executive of the Scottish Social Services Council, or SSC. And so I've just done a wee slide here to give a bit of oversight of who we regulate. So as well as regulating social workers and social work students, we also regulate quite a number of people working across social services in Scotland, children and young people. So that covers people who are working in early years services, in residential childcare and those types of services, and also people working in adult social care. And we also register the care inspectors, so the equivalent of the Care Quality Commission. And along with having the functions that Colm outlined, because we're all very similar in terms of what our focus is, we have that role in setting the standards of conduct and practice for social workers and also for employers. And we do that role around approving the degree courses that social workers will undertake and quality assuring those programs, And we also set and quality assure continuous professional learning and have a general role around developing the workforce. We also have a specific role around producing data on the workforce and have some accredited official statistics that we've been producing for quite a number of years now. And I think for the SSSC, one of the challenges we've had is the fact that we are regulating the different groups around social services. So we started regulating social workers back in 2003 and then gradually brought on the other groups. So for us, we have that challenge of trying to make sure that we are absolutely understanding the different needs of all the different parts of the workforce and are properly supporting their education and learning. So although social workers are the smallest part of our register, apart from the inspectors, they absolutely are so important and have been registered with us for the longest. I'm just going to talk a wee bit about some of the priorities for us at the moment. One of the main things that's happening in Scotland around social work and was formally launched on Tuesday is the creation of a National Social Work Agency, which is an executive agency of Scottish Government that has obviously a particular focus on social work, and I can talk a wee bit more about what that means later if we've got time. The agency is part of a formal partnership with local authorities and with Social Work Scotland, Chief Social Work Officer leadership type body in Scotland. And there's a real focus on all of these organisations and including us as part of that world of doing a lot more really focused work joined up together to try and improve lots of the issues that are facing social work at the moment. We were excited on Tuesday to be launching our post-qualifying standards in education and learning for social work. So having that one coherent approach across four different levels in social work that will underpin career development. So that was a big piece of work we've been working on. And we are looking at the moment about the possibility of registering social work assistants. We're doing a lot of work around it, and it will be subject to Scottish Government ultimately to decide. But that is certainly something that Government are keen that if possible we introduce, recognising that social work assistants have a really significant role working alongside social workers. And the other area that seems to never stop at the moment is there's so much legislative work happening in Scotland which affects social work. Sometimes it's not always clear to policymakers and Parliament about the impact of some of the legislative changes they're making on social work. So we're doing a lot of work around trying to highlight the impact on social work of changes and ensuring that particularly things are properly funded so the workforce can be supported. So I will stop now and hopefully hand back to Tracy if we think Tracy's microphone's maybe been sorted. Thank you.
Yes, let's give it a go. Tracy, if you're there and can pop back on the screen and we can...
Yeah. Matthew, can you hear me?
That sounds perfect.
Okay. So
I'll skip back to your slide.
I start from my slide?
Yeah, just give me
slide or start again? Which do you want me to do?
2 seconds. That sounds great now. That should be back on your first slide.
Okay, moving back on my first slide. So I'll just start all over again. Okay, that's grand.
There you go. Thank you.
Okay, thank you. Okay, good afternoon. We'll start again. So I'm Tracy Reid and I am the Chief Executive of the Northern Ireland Social Care Council. And thank you very much for the opportunity to speak here today. I have worked here within the council over the last, I suppose, 6 months, and prior to that I was a social worker for the last 25 years, primarily in adult safeguarding and adult social care. And my former role was that as Executive Director of Social Work in the Belfast Trust. So I suppose, as previously said, there was a sense when I first came into regulation, thinking I have so much to learn in this space, and often thinking to myself, well, I wonder, you know, as a social worker out there in practice, what really role does my regulator have in my life other than to say they will hold me accountable for a mistake that I make at my work? What is their role except to set standards and to to, I suppose, support me. And but over the time that I have come here, I have been really struck, I suppose, and never understood in a way that I was any way meaningful as to the purpose and the benefit of having a social work regulator that is present and around you and supporting you and driving and supporting the development of your practice. And I think here in the Social Care Council, that has been something that I have been very struck by and very much welcomed. Within Northern Ireland, the Social Care Council has been here for the last 25 years. And unlike some, perhaps Social Work England, we both regulate our social work students, our social workers, and also our social care practitioners and managers. So when we bring that together, we have just some nearly 49,000 people who we regulate here in Northern Ireland, which in a population of 1.93 million is a significant part of the population, and indeed the largest workforce in health and social care. Social work registration regulation has been compulsory in Northern Ireland since 2005 and social care since 2018. And I think we are at a realization that there is a connection and there is a coming together between social work and social care that often wraps around the lived experience of service users, and that it is important that we regulate in both of those spaces. In terms of our model of regulation, and I think this is the strength of the Social Care Council. When I came in as a practitioner who came into the organisation, the first thing that struck me about the Social Care Council was the fairness of the council. Yes, we have that role to protect the public, as every social worker and social care worker has. And we do that through our model of regulation, through our model of registration, setting those standards, but also through our workforce development. But we do it in a fair and transparent way that isn't really focused on, I suppose, punishing those who are who make a mistake in their work. We are here to deal with very serious aspects and those aspects that present a risk to service users and families and carers. And that is what we are really at and is at the heart of our model of regulation. So our ambition is to be a fair regulator as well as an effective regulator. We also, I think, recognise that we operate in a very changing world. And even as I can reflect on my career, the world in which social work and social care operates has changed significantly over the last 25 years. And one of the key aspects is our partnership working, where we are very committed to working with all of the different partners, whether it's service users, carers, communities, employers, educators, and other departments of health and justice, education, because we need to be sure that the regulation that we operate within, that the education that we commission, both at degree and post-qualifying, is relevant in the world in which we work in. And that is important because the types of issues that are emerging now are very different than the types of issues maybe we would have dealt with as a regulator 25 years ago. Interestingly, Colin was mentioning about that upward trajectory in relation to fitness to practice. And we're the same. We're 40% increase this year in fitness to practice referrals into the organisation. And indeed, we have an over 90% increase in the numbers of interim suspension orders, or one of our highest levels of sanction that we're administering this year. So there's something that's changing within society, there's something impacting on our workforce, and there continues to be growth in that. And that's why we believe that we have to work closely with others to maintain that piece where we are able to protect the public from the whole range of challenges that are out there, and to be understanding and responsive to the challenges that are emerging. One of the ways in which we do that, as I say, is partnership. And I put this slide up because I think there's a real role for us as a regulator, as the people who commission social work education, both at the undergraduate level, but also in that CPD post-qualifying. And here in Northern Ireland, we have very established mechanisms for doing that. We have our PEP, which is our Professionals in Practice, which is the CPD framework. It's one of the best there is, and I would say that, but it is one of the best there is, because it commits to that continuous improvement of social work, and it commits to those changing areas of being responsive to all the different challenges. And so recently, for example, we now have brought on the post-qualifying in palliative care, which is a real significant area of practice challenge. We have also done our adult safeguarding award and so forth. These all allow us to make sure that we are helping social workers to be trained properly, but continuously professionally developed in the areas of practice. And I just put up this one in terms of our undergrad. That's the level of partnership that sits around it. We're connected directly to the department. We work along with our strategic advisory groups that keep us making sure that we're representative from employers, commissioners, the departments of health and the degree partnership, and then in with our educators. And at the heart of that is participation. Social workers work with people. We work with carers, we work with service users, we work with adults, we work with children, and they must be the central voice in our work and our commissioning of education. And that is something that is very important to us. We also are very strategically aligned. So we sit along with, shape and influence those things that are impacting upon the social work and social care workforce. So here in Northern Ireland, we are very proud of our recently launched social care workforce strategy in 2025-2035. And within that, we have our social work workforce strategy also. We are very heavily involved in the reform of adult social care and children's social care here in Northern Ireland. And we are a key partner, we're a trusted partner at the table. And in that space, we are representing both the requirements for our registrants, but often the needs of our registrants as well. And I suppose just to conclude, I know that every regulator on here will say we're the best, but I think we're really good here in Northern Ireland. And one of the key aspects of the We Knew is often social workers are asking social care staff to do pieces of work on their behalf. And it is really important that those staff are trained to the standards and understand the whole aspects of social care. So here in Northern Ireland, we have just launched our care and practice framework, which is the first framework for the development of social care staff. And they work closely along with our social work staff. And I am delighted to say, and I know my other colleagues are sick listening to me saying this, but we won the European Social Services Award for Innovation in relation to this. So we keep pushing forward as a regulator, as a fair and relevant one, who need to be connected to our workforce so that we can understand their needs and how we best support them. Thank you. So I'm going to hand on to Sarah. Yes. Now we've got yours. So we're going to pass to Sarah.
Thanks, Tracy. That was really helpful. And it's always tricky going last because I don't want to repeat things that people have already said. But Pnawn da, Sarah Dwi, good afternoon. I'm Sarah. I'm going to provide a little bit of context about our work in Wales. I'm really delighted to be here today to celebrate Social Work Week. So I'm going to give a really rapid overview of our vision in Social Care Wales, and that's really about making a difference for care and support in Wales, for children, for adults, their families and carers. And we're currently engaging on our next strategic plan. Your reflections would all be really welcome. But we're suggesting we reframe our vision to really focus on what matters. That's a theme that runs through our legislation and the Social Services and Wellbeing Wales Active, how we support individuals and families to do what matters to them. Now, as an organisation, we've got a role across social work, social care, early years and childcare, and we're sponsored by Welsh Government. So I wanted to give a little bit of an overview about what we do, because some of the things we do are similar to some of our partners in other nations, and then we also do some things that are a little bit different as well. We work really closely with a whole range of other organisations in a similar way to what Tracy described, and involving people and always learning are some of our key values as an organisation. So we set standards for the care and support workforce, including social workers, social care workers, those working in domiciliary care, residential care. We work across adults and children's provision. We also support the development of the workforce, so people have the knowledge and skills to protect, to empower, and to support those that they are working with. We provide information for the public through data, but we also have videos and resources on what is social care, what is social work, that we've worked really closely with partners on. And we work with other organisations to support services to improve and to support innovation and look at research and collating evidence around what works to support practice and services to develop. So I was going to just describe a bit about what social work it looks like in Wales. So we've got 6,921 social workers registered with us working in adults, children's and combined services. We also, like Tracy said, register social work students. Our overall register is about 65,000 professionals in Wales at the moment. And we've seen a bit of growth in social work, mainly due to some of the local government, what we call grow your own schemes, where local government, local authorities are working to support individuals to work and also train at the same time. Now, most of our social workers are employed by local authorities. Most of our social workers are female. 44 is the average age of social workers in Wales. About 56% of social workers have some Welsh language ability. That's really important for us to be able to deliver services in the language of choice of individuals that are using care and support. And we've got a data portal which is publicly available for people to be able to look at data on the workforce and to really support workforce planning in Wales. Now, we also undertake an annual survey of the workforce. So we have a lot of data because it's really important for us to have direct feedback from professionals about what it's like to work in the sector, so we can work with our other partners to drive actions to support professionals. This is just a small subset of the data. So over half of social workers are coming to the sector to make a difference. We know we've got areas to work on. 18% don't feel safe. 50% have too much work to do or not enough time to do it well. So there's a whole range of data that we get that helps us think about what can we and partners do to support social workers to practice in Wales. So I was just going to touch on what does that mean then for how we're supporting social work in Wales. I'll emphasise again, a large majority of our work we take forward in partnership with the workforce, with employers, with other national organisations. There's probably too many for me to mention here. But we undertake, we are the professional regulator. We do have a code of practice and practice guidance for social workers that sets out expectations. We've got a new code coming into effect in July. We had really fabulous and great feedback from social workers across Wales to help inform some of those revisions. We do have a role in fitness to practice, as all other is common across all of us, I think, as professional regulators. And we're similar to some of the stats that have been shared with others. It's less than 1% of social workers that come into our fitness to practice arena, really low proportion of the overall workforce. We also quality assure social work education, but we also look to collaborate with social work education to think about how can we work with universities to continue to improve provision. So our conversation last week was looking at decolonisation of learning provision within our social work qualifying programmes. We're also looking at the provision of routes to qualify as a social worker. We provide bursaries. We also provide funding to regional partnerships to support some of the grow your own schemes. But we want to try and ensure that those routes are helping us support a diverse range of individuals to become social workers in all of our communities across Wales. We also invest in training and learning support for social workers. So as well as bursaries, we make a wider annual grant to local authorities to support both qualifying and post-qualifying training. And we produce learning on key topics that people have told us is important for their practice. So anti-racist practice, for instance, strengths-based practice are all resources that we have available. We have a social work workforce plan. It's 3 years old now, and we're just going through the revisions and updating that plan with our partners and professionals across Wales. And the social work workforce plan leaves enables us really to look at data, enables us to look at the feedback from the workforce, but also through our engagement with networks to identify the issues and areas that are really important for us to be able to progress to support the social work profession in Wales. That will cover a range of themes like wellbeing, support for retention, learning and development, and what actions that ourselves and partners can then take to try and address those, be that local government, national government, BASU or others. We also support social workers to use research to enrich their practice. So we provide access to e-library journals, and we produce evidence summaries on topics that people have told us are important. So, for example, my team have produced evidence summaries on responding to child to parent abuse or supporting neurodivergent people and their families. So the research team basically look at all the research available and they really distill it down into a few pages of accessible information with the links to the journal articles if you want to go into more details. We also have communities to support practice on topics like embedding evidence or new models of care. And we also develop wider resources like AI guidance to try and support professionals in their practice. And finally, the other thing I was going to mention is that we work with partners to raise the profile of the profession. We do that by sharing data and information. We also hold annual accolades to celebrate practice in the sector. And we have a national brand, We Care Wales, which supports attraction into the sector. And we use real life people, real life social workers who really lend their face to the campaign to say what it's like to be as a social worker and to inspire others to consider social work as a career. So I hope that wraps up all of the tour of the UK today. Yeah.
Thanks, Sarah. Thanks very much. And thanks, everybody else. I'm just going to drop these slides down and bring everybody else up on screen so we'll be able to see you all. Oh, no, we've lost. Oh, we keep losing. There, we've got you, Tracy. Hopping on and off there. Thanks very much for that, everybody. We've had quite a lot of questions come through, and I'm going to try and be slightly clever and group them together into themes and try and have a bit of a discussion on some of the themes that have been coming through. So yeah, let's see how this goes. So one of the in all the presentations, I think like words were quite loud and clear, really, in terms of like partnership and collaboration and engagement and communication. I think that came out in everyone's presentation. And some of the questions that have come through have been around, so how do all organisations really ensure that those voices and the realities, I suppose, of frontline practice are not only heard by regulators, but sort of used and taken into account in any sort of guidance or in any sort of developments or any sort of processes. Like, how is that done, I suppose, is the question. So how do we just ensure that those sort of frontline voices are heard? I'll open it up, just jump in.
Will I jump in, will I, or does anybody else
Colin.
want to come in? Can I just say, clearly I've missed the memo about the background and being suitably corporate. So sorry about that, but at least you have our background, Matthew. So
there you go.
And this is a nice picture of our office. So that's something. I think that's a really important question, and that was part of the reason why I kind of looked at the sheer numbers in terms of the numbers of social workers who and the work that they do across all sorts of communities in England, and that will always be a challenge for us as a national organisation to be able to engage with people in the right way and to ensure the voices are heard. So I think it's through a range of various things. I mean, we have looked at, there'll always be kind of the baseline consultations and putting stuff out there for people to feedback on any significant developments that we might be working on. We have our National Advisory Forum, which is a forum of people who lived and learned experience of social workers themselves, and we have a forum around education and training. And also we have Matthew and his team of regional engagement leads who are based in each of the regions and have lots of opportunity to engage with people locally and take those opportunities to do that. And somebody mentioned earlier on about survey and to kind of having an annual survey to get information back. So there's no one thing I think that allows that kind of opportunity. We occasionally go on these road trips, and Matthew, you were part of the organising the road trips where we went around various parts of the country and talked to people about specifically around fitness to practice, CPD, and education and training to get a sense of where people were at and what they thought we should be doing and where the emphasis should be, and so there's a whole range of kind of opportunities that we can present, I think, but it's never fully complete, and I think it's an area we'll always continue to work on, and trying to get that get it, make sure that we're well engaged. And it is a challenge in terms of just the size of the world we're in. But the other thing that I think Tracy emphasized was, and everybody else emphasized, was just how you build partnerships and collaboration and ongoing kind of engagement with people. But it's really important, I think, that we are connected to the real experience of social workers and what their real experience is, because to be relevant to them, we have to be connected.
Yeah, thanks, Colin. I appreciate as well that this might have felt as I was just teeing Colin up to praise me and my team of regional engagement leads, but it really wasn't that. That was a question and themes that were coming out of the chat. Go on, Marie.
Yeah, I was just going to add that, yes, we do similar things, but we just introduced last year the supported first year in practice for newly qualified social workers. And one of the interesting things that I think about that is that has been a forum where we're doing a lot of really specific engagement and support sessions with that coterie of newly qualifieds coming through. So it's probably building quite a different relationship between the regulator and those newly qualifieds than previous social workers coming through and entering the profession have had. Just kind of thinking about the point you were making, Tracy, as somebody who's come from the profession into being the chief exec in Northern Ireland, and your perceptions of the regulator beforehand and what you've seen now in your role. I think, I'm certainly hoping that through the introduction of that first year in practice, although it's not the primary aim, is for people to have a better relationship and idea of what the regulator does. I think that will be one of the byproducts that I think will be quite helpful, that there's a really good route in. I was at the launch for the National Social Work Agency on Tuesday, and there were tables of different people working in social work there, including a table of social work students who gave me a bit of a grilling around some stuff. So definitely being out there face to face with people is so important.
And I suppose I would probably just reiterate that as well. I think it is that piece which is around being visible and being engaged. And I think within the council, we do that on a number of levels. So we do have our registrants form here, which are links to all the areas in which social work is practiced. But we also then, I suppose, in terms of with registrants, we are very much engaging with them and having that partnership with them in the things that we do. So the resources we develop, the training we deliver, the communication and about the profiling of social work and all that it does. Last week we launched the Holding Space exhibition for Social Work Month, and it really was an opportunity to go out and meet social workers in every area that they practice, to capture that through art and photography so that they could represent the work that they do. So I think for us, in everything we do, it is partnership, but we still need to do more and a lot more, because what I get a sense of from social work is social workers are busy. They're facing significant challenges. And, when I go out and we have those honest conversations, they will say, well, yes, I would love to, read your website. I would love to access those resources. I can't hardly get a cup of tea. So that is where we're trying to find the places and spaces in which we can engage and the different mediums. So I think it's something that that partnership with our registrants, because I think it's an important partnership, because here in Northern, I'm sure it's no different than the rest. Our standards are set for our registrants, but our standards are also set for employers. And so what we want to be being sure is that we are also bringing a voice to employers on behalf sometimes of the issues that registrants are encountering. And I suppose it's always important for us to have those connections so that we're influencing and shaping in the right way. So we do it through, like exactly as Colin Marie have said, through many mediums, but it is constant activity because of the challenges I think that exist within the workforce.
Yeah, I'll just build briefly on that, Matthew, because we'll run out of time today, won't we? So we'd have a similar range of formal and informal networks and engagement. And I think that's really important. So we will do things like an annual survey because it enables us to look at how things are changing over time. Are things getting better, or are new issues emerging? But also because it enables us to present that data back to government and others, to be able to really look at where we need to continue to make changes. But those informal networks and where social workers are working with us as part of our planning and delivery for our own social work week sessions, the visits that we'll do out to see social work teams, the surveys, and then the work and engagement that we'll do in a whole range of places all help build that picture. We'll continue to do that targeted engagement on specific pieces, but we're also trying to look at how we have those open doors as well to any and wider areas of work. But I'd agree with Tracy, we're trying to be responsive to the workforce pressures that we know exist, and so it doesn't become another burden. So we maximise the opportunities about how people can be engaging with us, but also sharing the issues that are really important to them.
Thanks, everyone. And I think this question probably slightly leads on, but it's more sort of fitness to practice focus, because obviously I think all of the organisations have touched on fitness to practice data and that rise in fitness to practice concerns coming into all the organisations. And obviously there's then lots of work happening in the background to understand some of that and to break that down, and some of that data and intelligence that might sit beneath that. But some of the questions have been about like how or what can be done in terms of sharing, I suppose, any of that insight from fitness to practice to be more sort of to look at system-wide improvements as opposed to just the individual outcome of the fitness to practice, which obviously is really important that that's managed in the most efficient way possible. But then what else can be done with that learning and with that data? And I think it was you, Tracy, that touched on that sort of employer, like what work can be done with employers to maybe do some of that. That was a long question. I appreciate it. But yeah, just what can be done with some of that intelligence that all organisations have got to sort of support that wider growth and development and learning.
Actually, Matthew, that's really relevant because we've been having that discussion actually this week and over the last number of weeks. Because obviously the core function of the regulator is to ensure quality and safety within social work and indeed social care services in Northern Ireland. And that piece coming around, I think that's the tail back. So that it is through how do you continuously feed back into the quality of services. And the patterns that we pick up in our fitness practice are really, really important. And we need to get a better way, I think, of shaping that and that continuous improvement. So how aware are employers of the trends in their area? How aware of our registrants even aware of these issues? It's an interesting fact because when I talk to social workers, the one thing they absolutely generally tell me that they read are the outcomes of the fitness to practice. They read them, they discuss them, and they're aware of them. But actually, I think it's that part which is about now, how do we turn that and bring it into the improving the quality and safety of the care that is being delivered out there and the support that's being delivered through social work. It's an interesting fact that I think we will have to give thought to this, because it strikes me from some of the things that I see that whilst fitness to practice matters are referred to us about the work that people do whilst in their employment, there is also a significant piece around what people are doing in their private lives and how that is affecting their fitness to practice. I think that's more of a challenge, but I think it's a space we need to bring awareness into.
Yeah, thank you. Any other thoughts on that one?
Yeah, I think we're doing some work specifically with the system regulator, the care inspectorate, that is that sort of intelligence piece to try and join up what they see from inspections and what we see, because as you said, Tracy, there is that bit that actually is about behaviour, but both outside work and inside work, that actually goes to a values piece. Then there's a bit that is about practice. But I think all of us see that challenge around referrals coming in where it's not really about a fitness to practice issue. Referrals coming from people who use services who are actually frustrated with the level of service that they're receiving, and that becoming more of a challenge. So we're trying to do that piece better than we previously have, where we're joined up with the systems regulator to look at what can be done jointly around that from an employer's perspective.
I think we'd be similar to you, Marie, really, where we're working closely with our service regulator, the Care Inspectorate Wales, for us about how we can collaborate on areas in terms of where those issues are coming through. So we do have a number of fitness to practice cases where something illegal has happened, and that's a real small minority of the workforce, and that seems to happen in any regulated profession, and a real small minority of cases where I'm not sure there's the same learning as what we get if we look at our wider referrals and some of the areas where there's an opportunity to think about how practice could have changed or been adapted or been developed. And we try and balance that, having a being very open and accessible as a regulator, so people are talking to us about areas of their concern and approach, so that we can be working through and thinking about how do we shape up and improve our practice guidance and the other resources that we've got available for support. So I think fitness to practice data is really important, and I think we can learn a lot from it. I also think we can learn a lot from all of the brilliant practice that we also know happens across all of our communities, and that we've got to strike that balance of learning from what's going well as things that haven't gone well as well.
Yeah, and we similar. We're researching now on what our kind of fitness practice profile looks like. I mean, for example, 90% of the concerns that come to us from the public don't get past the first threshold. So we want to look at that with employers and work out, well, why has that happened, but also what we can all learn in terms of the workforce development. I'm always kind of look at the powers that you guys have in and around workforce development, and the opportunity to do that in a way that we don't quite have that in the way that we're set up. But that kind of post-qualifying, how we can help to develop the themes to support good practice there, I think is really something that we're very keen to explore and develop further.
Thank you. I had two more questions, but we've not got time for it. But there was one question that I wanted to end on, just because I thought it was quite a nice way to end, really. And it was, if you could send a message to a newly qualified social worker who's entering into the profession, what would it be?
I suppose I would say travel hopefully. That's my mantra. That's got me through my career. As a social worker, you are in difficult spaces, and sometimes things can be challenging. But we are the profession that brings hope into people's worlds, and although things are difficult out there today, we need to just keep on that hope. Things will. If I could tell my younger self one thing, the things I worried about then, I can't even remember now. And that, always remember that. Sometimes you'll be in difficult situations, but keep going. It's a brilliant profession, and I wouldn't have wanted to be anything else.
Yeah, I'd say, I suppose, being from a social work background as well, I would concur with something along those lines as well, Tracy. I mean, I'm at the other end of my career, coming towards the end of it, and I don't regret a moment of becoming a social worker. And while it has had many ups and downs, the impact and feedback that I've received over the years in different times has been the greatest source of hanging in there. So I would always say, regardless of what may happen ahead, never forget your motivation for going here in the first place. And we look at the motivation from students, and it's always about wanting to help. Never lose the motivation, regardless of the circumstances you might find yourself in.
Yeah, I think I would say I'm not from a social work background, but be really proud of your profession. I've worked really closely with social workers at the SSC for 16 years now. I've learned so much from them. It's such a profession that approaches things from a perspective of focus on the strengths that people bring to a situation, my background was very different in terms of how you approach things. So I think just be really proud of your profession.
And I think the element I take, I suppose, to build on that is, put quite simply for me, social workers transform people's lives. That role of empowering, advocating for, and being able to support people often when they're at their most vulnerable points in their lives is just incredible. And I think any of us that work alongside social workers or have had social workers in our own lives or in our families' lives know what difference that makes. And so it's remembering the people we're here to support, I think, at the end of the day.
Thank you. And I appreciate that I'm slightly over, which is my fault because I'm the chair. But Social Work Week is supposed to be a celebration of the profession as well. So I really wanted to end on a positive, and that's why I held that question to last. So really appreciate everyone's commitment and contributions today. I appreciate there's some questions in the chat that we haven't been able to get to. We didn't even touch on AI, which has been, as always, comes up. And there's lots of sessions that have been held throughout the week on AI, and there's more to come as well. There's been a link put in the chat for the evaluation form. Huge appreciation for everyone's attendance today. If you could fill out that form, that'd be really great. And yeah, thanks again for everyone for presenting today. And yeah, take care, everyone.
Thanks.
Thanks
Thank
very
you.
much. Thanks, Matthew.
Bye, everyone.
Thanks, everyone.
Bye.